Welcome, welcome everyone to tonight's Acts 2 workshop. Diagnostic, treatment, and support services for older Floridians with memory problems. What to know and ask. I'm Dr. Rob Glukoff, servant leader of the Acts 2 project and professor, Florida State University College of Medicine. In case you are unfamiliar with the term Acts 2, it stands for African American Alzheimer's Caregiver Training and Support Project 2. Folks, I am excited about the prospect of tonight's workshop. This workshop will provide practical information about Florida's state-supported network of memory disorder clinics. Persons with memory loss and their family members often have questions about how to select providers of memory evaluation and treatment services who will best meet their needs. Here's your opportunity to have your questions answered by persons in the know. Workshop presenters Justice Lewis and Stephanie Malally, social workers and clinical coordinators, will describe the types of procedures included in memory assessment and their costs, as well as treatment options for memory disorders such as Alzheimer's disease. They also will describe community-based educational programs state-supported memory clinics offer. Family caregiver and dementia care advocate Priscilla Jean-Louis will share her journey in seeking memory evaluation for family members with cognitive decline and education to inform her personal caregiving needs. Last, Acts 2 project coordinator Tamika Norton-Brown will provide information about faith-based skills training and support for dementia caregivers, as well as local, state, and national dementia care resources. Before I introduce this evening's presenters, I want to recognize our partners who have contributed both resources and guidance in the development of Acts 2's Dementia Caregiver Workshop Series. Acts 2's primary collaborators are the Florida Progressive Missionary and Educational Baptist Convention, Florida State Primitive Baptist Convention, Florida General Baptist Convention, Florida Church of God in Christ, African Methodist Episcopal Church, 11th Episcopal District, and Florida State University College of Medicine. Turning now to tonight's presenters, we have 4 inspiring speakers. Our first presenter, Justice Lewis, obtained her bachelor and master's degrees in social work from Savannah State University. She has an impressive background in case management for various healthcare populations, particularly persons with behavioral health concerns, housing insecurities, and neurological disabilities. Her passion for working in the area of memory loss emerged from her previous position as social work team leader of case management services at Tallahassee Memorial Healthcare. In her current role as memory disorder clinic coordinator at Tallahassee Memorial Healthcare, Justice provides counseling, education, and support, as well as referral to community services for persons with dementia and their families. Additionally, she serves as co-chair of the Dementia Care and Cure Initiative Task Force for the Florida Eastern Panhandle and as facilitator for the Powerful Tools for Caregivers program. In her free time, Justice enjoys exercising, do-it-yourself projects, and traveling. Our second presenter, Stephanie Malally, is medical social worker at Lee Health Memorial Care Clinic in Fort Myers, Florida. She received her Bachelor of Social Work degree from Sacred Heart University in 2001. She subsequently obtained her Master of Social Work degree from the University of Central Florida in 2019. Stephanie has an extensive history of working with abused and neglected children, families in low-income housing, and older adults with memory loss. The last 8 years of her career have been devoted to ensuring optimal quality of life for older adults with dementia at state-supported memory clinics in Orlando and Fort Myers, Florida. She enjoys this line of service, providing support and resources to family caregivers and their loved ones with dementia, and is co-chair of the Dementia Care and Cure Initiative Task Force for the Lee County region in Florida. Our third presenter, Priscilla Jean-Louis, received her bachelor's degree in criminology from Florida State University. She is the owner of K&D Creative Designs and Marketing Solutions, a business specializing in graphic and web design, video production, and social media marketing. As a marketing professional, Priscilla uses her skills to spread the message about dementia and caregiver support. Her passion for advocacy stems from her family commitment as caregiver for her mother living with Alzheimer's disease and her grandmother who passed away in 2022 from the same condition. These experiences led her to start the My Favorite Girl, an Alzheimer's social media platform, and the My Favorite Girl Caregivers Corner podcast. Priscilla's advocacy work in dementia care has led to public acclaim for her leadership in Tallahassee and the Florida Panhandle area. Last, Tamika Norton-Brown is coordinator of the Acts 2 project. She has worked in the area of survey development for the past 23 years. Tamika has served as caregiver for her dear aunt and uncle with dementia and has just an extremely high level of passion for helping others. She has been a great source of encouragement and support for literally hundreds of family caregivers of older adults with dementia across Florida. Mrs. Norton-Brown is also a strong leader by example in her church community. Folks, during the course of the workshop, I encourage viewers to share questions to be answered after each presentation using the text message function of Facebook Live. We also will have a 20-minute question and answer period following the last presentation. And now we have Justice Lewis, MSW. Welcome, Justice. We are so excited to have you here this evening.
Thank you so much, Dr. G, for that amazing introduction. It's an honor and privilege to be here tonight. All righty. As Dr. G mentioned, my name is Justice Lewis, and I serve as the coordinator for the Tallahassee Memorial Memory Disorder Clinic. And on tonight, I will be presenting Enhancing Memory Care, an overview of Florida's memory disorder clinics. Next slide, please. So our learning objectives for this evening will be learning the history of memory disorder clinics in the state of Florida, the services offered by these memory disorder clinics, an overview of what the staff composition may look like at the clinics. We'll dig deep into the Tallahassee Memorial Memory Disorder Clinic and community resources that are available to you guys. Next slide. So a little brief background history when it comes to our memory disorder clinics. In 1985, the state of Florida realized that there was a need for ongoing support and resources for individuals living with Alzheimer's disease and related dementia. This led to the launch of the Alzheimer's Disease Initiative. With that initiative, there is two innovative components that they focus on, which is one, the memory disorder clinics, and then two, the Florida Brain Bank. So beginning with the Florida Memory Disorder Clinics, as of today, there are 17 memory disorder clinics throughout the state of Florida, and they have been strategically placed in locations that will focus on urban and rural community. The purpose of the memory disorder clinics is to provide a comprehensive diagnostic treatment and referral services to those battling memory disorders. Next slide, please. And so in 1986, that came with the development of the Florida Brain Bank. And that entity is designed for individuals that have passed away or deceased. It gives them an opportunity to perform research on the brain. And that was so we can make sure that our diagnoses are accurate and also lead to additional research so we can better find a cure for dementia, and also understanding the progression of the disease. As of today, we receive so much support from the state of Florida when it comes to this initiative. They're so involved in making sure that the individuals that are living with Alzheimer's disease or related dementia are feeling inclusive, and that the services could cater to them and not only to the patients, but their caregivers as well. Next slide, please. So this is just a visual of the 17 memory disorder clinics throughout the state of Florida. And as you can see, they range from North Florida all the way to South Florida. So if you or your loved ones are looking for a memory disorder clinic, I'm pretty sure that we have one on our map locator. So you can find this at the Department of Elder Affairs and searching under memory disorder clinic, and there's a map locator link. And if you were to click that link, it'll lead you to the different locations, and you'll be able to find one that's better supporting you and your family. Next slide, please. And so now we're moving on to the services that you will see at a memory disorder clinic. And so even though we have the different memory disorder clinics throughout the state of Florida, we all have unique services and operate a little bit different. But the overall goal for the services at the memory disorder clinic is to improve diagnosing, treatment, and the overall well-being, and making sure that we're offering comprehensive support to patients and our family. And some of the services that could include diagnostic evaluations, medication review, psychosocial assessment, even advanced care planning, offer clinical trials and research opportunities, and also focusing on behavioral health support. Next slide, please. And can we go back forward one slide, please? Awesome. Thank you. And so similar to the services that I mentioned at the memory disorder clinic, their staff composition. Of course, we know that every memory disorder clinic is probably not going to have the same set of staff. But when we're thinking about the staff composition, we purposely designed to make sure we're providing comprehensive care. So the staff is structured to ensure our clinics are offering patient-centered services while addressing medical, emotional, and social aspect of memory disorder clinics. So when we're thinking about some staffs at those memory disorder clinics, you may see a neurologist, a neuropsychologist, nurse practitioner, registered nurses, social workers, case managers, research coordinators, and administrative support staff. Next slide, please. And so now we're going to look at the Tallahassee Memorial Memory Disorder Clinic. So we are affiliated with Tallahassee Memorial Physician Partner Neuroscience Center. And our clinic is broken up in 3 sections, and that's probably the simplest way to say it. But we have neurology, and as you can see, those are our neurology providers, Dr. Chukalin, and then we have nurse practitioner, Ms. Melinda Folkert. And then we have neuropsychologists, and that's Dr. Gaz, Dr. Persinger, and Dr. Motisanti. And then we have a movement disorder clinic that's focusing more on Parkinson's disease. And we have Dr. Urea and one of our nurse practitioners, which is Patrick Walker. And then we have an amazing team of social workers there, which is Jamie, myself, and Whitney. Next slide, please. And so I love to focus in on the role of the social workers because that's what makes the memory disorder clinics a bit different than your regular neurology clinics. And so with the Department of Elder Affairs, the memory disorder clinics are state funded, which allow us to have free services for our patients and the community. So when the patients are coming to a memory disorder clinic, they're typically meeting with the neurologist to get that first evaluation done. That evaluation typically takes 60 minutes. And following that meeting with the neurologist, they will meet with a social worker. Social workers are required to meet with all new patients, and then it's by need basis for any follow-up visits. And so during that first visit with the social worker, we're typically completing a needs assessment, identify what services the patient or their caregiver may be looking for, and also what resources we can offer them. A lot of times when a patient is coming into our clinic, the medical information can be a bit overwhelming. So our social work team is also providing emotional support, whether that's understanding the diagnosis or even facilitating a conversation when it's time to stop driving. A big piece that we focus on at the Memory Disorder Clinic is providing education. As we know, education is very important when it comes to raising awareness and also when it comes to preventive care. We also refer you out to community resources, and I'll be able to talk about that a little later in the presentation about what community resources we utilize a lot. Planning for the future is so important. I tell my patients that come to the clinic, even though you may be in the early stages, making sure what your needs are and how you want your quality of life or end of life care is super important. So planning for the future and being proactive is something that we advocate for. Telephone support and helpline. Something about our social workers is that we not only provide those free services to our patients, but we serve as a helpline to the community as well. So if an individual or even their family member or just a caregiver in the community is looking for guidance with in-home placement, facility placement, respite care options, or just needing more education about understanding the disease, that's something that our social workers are able to provide you as well. And then also we have a lot of collaborations where we're working with the neurologist, the nursing staff, physical therapy, occupational therapy, speech therapy to make sure that we're coming together with the best treatment plan for our patients. And lastly, our social workers are able to offer free memory screenings. And that's just a rapid screening tool that we use, which is called the mini mental state examination that looks more at your thinking, repetition, and recall. I like to emphasize this is not a diagnosis once you're engaging in the memory screen, but it does provide you with a baseline of where you are with your cognitive functioning. Next slide, please. And so just focusing on a little more what we do outside of the clinic. So we're involved in the community heavily around the city of Tallahassee and also the Big Bend area. So we're providing education and training. That is super important because it allows us to enhance care, provide ongoing support to our patients and family, and create a dementia-friendly community. One of the 3-part series that our Memory Disorder Clinic in Tallahassee offers is a 3-part series that does an introduction to dementia, which we call Dementia 101. Then we focus in on the warning signs of Alzheimer's disease, and then 10 ways to love your brain. So we're able to visit different skilled nursing facilities, memory care facilities, or even training healthcare providers. Next slide, please. Community outreach and engagement. This is probably one of the most amazing things and favorite things that I do in my role as the coordinator, but it gives our staff the opportunity to promote awareness. As we know that dementia is ongoing and at this time, there's not a cure for it, but making sure we're educated and awareness is going on so we can break that stigma when it comes to early detection if we're having symptoms of memory loss. So making sure that we're also providing a supportive network for patients and their family, linking individuals with appropriate resources. Next slide, please. Advocacy work. So when it comes to the Memory Disorder Clinic, advocacy work is super important because, as I mentioned before, we're raising awareness when it comes to Alzheimer's disease and related dementia. We're advocating for access to resources, improve healthcare policies, increase funding when it comes to research. But the most important thing that we want to do is amplifying the voices of those affected by Alzheimer's disease and related dementia. One thing that our clinic does here in Tallahassee is that we make sure we're active participants in the Alzheimer's Rally for Tally that happens annually. Next slide, please. Research. So research is one of the, outside of providing the care to our patients, this is another component that we focus on at the Memory Disorder Clinics. So research drives innovation when it comes to treatment, diagnostic tools, and care, and paving the way while we are working on potential cures when it comes to Alzheimer's disease and dementia. Research allows us to uncover causes of memory disorder, test different medications, therapies, and interventions. One thing that I really enjoy about research is that it also allows us to focus on non-medical interventions, and that could include cognitive exercises, diets, and making sure that we are socially engaging. Next slide, please. And so now we're just going to talk about some community resources that our local memory disorder clinic utilize a lot. Next slide. So we have the Advantage Aging Solution, or you may know it as the AAA. This is an amazing resource as it has access to the elder helpline for resources and support, but they just have a lot of programs that are geared towards older adults. So if that is something that you're interested in, I definitely encourage you all to engage and maybe research what the AAA can offer you or your family. Next slide, please. The Alzheimer's Project, amazing resource here in Tallahassee. They're a nonprofit organization, but they offer support for individuals and families with Alzheimer's disease and related dementia. One of the many things that they offer is support group, caregiver support training, counseling services, and respite care options for most, I think, Monday through Friday. Next slide, please. The Alzheimer's Association. This is a great online research hub for any online education, research opportunity, and overall support when it comes to Alzheimer's disease. Next slide. And then lastly, we work very closely with the FSU REACH program, which offers educational training for older adults, caregivers, and professionals. So if you or your loved ones are looking just to know more about the disease, or even in our professional environments, if you're wanting to get your staff changed on how to ensure that you're promoting a dementia-friendly environment, this is a great resource to have. Next slide, please. And that's the end of my presentation. And now I'll just open it up for any questions.
That was outstanding. What a great overview. Thank you so much, Justice Lewis. I have a couple questions for you.
Okay.
Just to get a better handle on what the differences are between the 17 state-supported memory disorder clinics and going to a private practice neurologist or a family physician for diagnosis and intervention. What do you believe are the most salient features of the memory disorder, state-supported memory disorder clinics as they compare to going to a single neurologist or a family physician in the community?
Right, absolutely. That's a great question. I always tell, whether it's patients or individuals that I'm meeting in the community, definitely you maybe want to start with your primary care doctor just to get a referral to a neurologist. And the reason why we press having that referral from the neurologist, because we know that that's what they specialize in. So we want to make sure when we're doing accurate diagnosing that you're checking off all of the boxes and that we're meeting everything to ensure that whether they're going to diagnose you with Alzheimer's or dementia, that is going to be accurate. So I always say, start with maybe your primary care doctor to just get the referral to a neurologist. But when we're focusing in more on the memory disorder clinics, I think having that team of social workers and case managers embedded into those neurology clinics allow us to not only talk about the medical aspect of the disease, but also address any mental, emotional, or social aspects that may be impacting the patient or their family.
Thank you. That was a really good description of the differences. Just focusing a little bit more on education, you mentioned that as a social worker in a state-supported memory disorder clinic, you provide educational services in the clinic to persons with dementia and their family caregivers. What types of educational services would you typically provide?
So really just making things more in simpler terms, because as we know, we love our physicians, but we can be overwhelmed with some of the medical terminology that they're using. And so after meeting, with the doctor, they're kind of like, oh, that was a lot. So what we're doing is just breaking it down in simpler terms so they understand the difference of what type of dementia, because I don't think a lot of people understand that dementia is an umbrella term, and there's different types of dementia. So depending on which type the doctor has diagnosed that patient with, we provide that ongoing education there. But not only just with the patient, but we're also focusing in on the caregivers, because we know they play an amazing and an important role in the lives of our patients. And sometimes they may be frustrated in seeing this change in their loved one. So making sure that we provide them with education on knowing how to move forward with this diagnosis, something that our social work team is able to offer.
Well, thank you so much, Justice. Well, we have affirmation from you from Miss Whitney Gianna. Great job, Justice.
Awesome.
I'll give an amen to that. Well, Justice, I have about 5 or more questions, but I'm going to defer to the presentation that we'll do with the entire group at the end.
Okay.
Thank you so much.
Thank you.
Now we have Stephanie Malally. Welcome,
hello, Dr.
Stephanie.
Thank you, Dr. G. I'm honored to be here.
Thank you, and look forward to your presentation.
Thank you so much. Well, good evening, everybody. As Dr. G mentioned, my name is Stephanie Malally, and I am the medical social worker and coordinator for the Lee Physician Group Memory Care Clinic in Fort Myers. So tonight, I'm going to coincide with my counterpart, Justice, and talk about what to expect and how can we help when coming to a memory disorder clinic. Next slide, please. So just to give an idea, which this information is always so eye-opening to me because Alzheimer's, dementia, it is a healthcare crisis. Florida has the second highest amount of Alzheimer's cases in the US behind California. So it is an expensive diagnosis. It's up there with cancer, things of that nature. So they are estimating that this year, an estimated $360 billion are going to be paid in regards to health and long-term care costs for individuals living with Alzheimer's disease and the other related dementias. And there are over 100 different types of dementia. So it gives a lot of room for cost and providing services. We do see Medicare and Medicaid are a lot of times the primary payment sources when it comes to the treatment and clinic component. And the estimate is $231 billion or 64% of the total healthcare and long-term payments for these individuals pertaining to Alzheimer's or the other related dementias. So the insurance, thank goodness for insurance, but that is definitely taking a big bulk of the cost for care. And then last but not least, out-of-pocket spending, because unfortunately, sometimes with insurances, they may not, clinics may not be in network, things of that nature. So there is expected to be $91 billion or 25% cost of total payments. So it definitely is a financial burden at times, and that's where that planning and proactiveness that Justice mentioned is so important. Next slide, please. So let's take a look at some of the key issues that we see at the clinic when it comes to coming to the clinic and getting services, getting diagnosis, getting treatment plan, because we do see resistance at times because it can be scary, not only for the individual with the memory concerns, but also for the family as well. So we do commonly see denial, not wanting to accept that memory issues are happening, that forgetfulness, short-term memory is being impacted, Definitely talk to patients when I've met with them, where they are like, I'm okay. There's no issues. I don't see any concerns, or maybe I just forget every now and then. So having that acceptance definitely takes time, and it is baby steps. So that's where the clinic team is very helpful in providing that support, education for the patient as well as the family. There's also fear. None of us don't like the unknown or changes or what does this mean. So, receiving a diagnosis, Alzheimer's or any of the other dementias, or diagnosis in general, can be scary. So that's really where the support, the education, as Justice mentioned, breaking down into layman terms, can help ease those fears. And just knowing that being diagnosed with a form of dementia does not mean that their life has to end. It just may look a little differently. We can definitely see embarrassment. People feel ashamed just asking for help, or they may not want to ask for help. And, depending on family history and backgrounds, it can be common for the family just to handle things on their own. I know with my family, initially, we wanted to handle things with caring for my grandmother and everything like that, and then realized more help was needed. So that can definitely be a common factor. Next slide, please. We can definitely see stress by that unknown factor, or just not being in control. We like to have things planned as much as possible, or control. So not knowing what is going to happen. I've definitely spoken to patients where they just received the diagnosis, and what do I do now? What does this mean? So helping them talk through, providing information, providing education, but at their pace, because they're getting bombarded with a lot of information at once. So providing it at their speed when they're ready, and then being continuously that resource. Unfamiliarity is definitely a good point that we make, or that we see, especially when it comes to caregiving in the home, and having like private duty companies or home health companies coming to the home to assist with personal care or skilled services. The individual doesn't know the person, so there can be some anxiety, some paranoia related to that. Definitely have heard regularly, I don't want anybody in my home. So having conversations, reassuring the individual that this is to help, or it's to help the family member. So taking the focus away from the individual, so that way they know it's not just about, they're not a problem, they're not a burden. We're here to help. We're doing this as a team. And then we have misunderstanding. Definitely, as the diagnosis of Alzheimer's or any of the dementias progresses, it is a progressive disease. The verbal and nonverbal communication can change. So, what may be a normal instruction or question or task to us can become more challenging and overwhelming for the individual. So they may not understand what we are asking them to do. So keeping it simple, step-by-step task, and giving that extra bit of time for them to respond, for them to process, is so necessary, because it can cause them to become frustrated as well as the caregiver. And patience is definitely a virtue when it comes to this diagnosis. So it definitely is something to be mindful of. Next slide, please. So why choose a memory disorder clinic? And as Justice mentioned, there are 17 of us in the state. So we are here to assist. We are designated certain counties within the state, so that helps determine our coverage area per se. But we really work together as a team to help determine diagnosis, treatment plan, providing counseling and resources, as Justice mentioned, not only to the patient, but to the caregiver. Both entities are as important as the other, because there's caregiver burnout, there's stress for the patient, the changes they're going through. So we're here to be a support for both components. We also do extensive new patient assessments to where we're not just focusing on the memory component. We look at the whole picture to ensure that it's not something else going on. If it's something related to diabetes or side effect to medication. So we get the whole family history, physical examination, blood work, neuropsychological testing, CAT scans, assessment, many memory screenings. We do the whole process to help determine the diagnosis. And that's why it's very important for the family or caregiver to participate in the appointments with the patient, so that way we can get the full picture. I know, and that's something that's not common with our primary care or other providers. It's normally the patient going in. So having the family or trusted individual involved can be very helpful, not only for the patient, but for the clinic team as well. And like I mentioned, we provide that support and resources for the patient and the caregiver. And it is a holistic team approach. So many disciplines, from neuropsychologists, psychometrists, the social worker, the provider, caregiver, we're all involved, the patient, in the care, the next steps, and meeting that patient's needs, and the safety and supervision. So we definitely, I like to call us one-stop shops, because we have that clinic side as well as the community side of things. So really trying to encompass the medical, the testing, as well as education and brain health support services. Next slide, please. So let's take a look at the general cost when it comes to clinic services. And this does not vary when it's, from a neurologist or other specialist. So it's, across the board with things that we look at. But if an individual is paying out of pocket, then the services can range from $200 to $600 per visit. What determines that $200 to $600 price range? It's the level of services being provided. So I know for us, we have things set by tier. So for like new patients and individuals coming in for diagnosis, those costs for service is going to be more, because things are being ordered, lab work, testing, additional testing, CAT scans, where a follow-up appointment for routine checkup, maintenance of medication will be less. There's no sliding scale. So if anything, if an individual doesn't have insurance and they're not able to pay out of pocket, the healthcare entities have financial assistance programs that can work with the individual. So that way, one way or another, the patient will be seen. When it comes to insurance, we accept a variety of them, from Medicare to the Advantage Medicare plans, to Medicaid, to the VA coverage from TRICARE and CHAMPS, and self-pay, as well as commercial plans in the financial assistance programs. Now, this can definitely vary because we know insurance can be overwhelming. There's contractual aspects with the entities that these insurance contract with. So there may be certain plans or companies that are not accepting or working with the particular entity. I know for our particular clinic recently, Florida Blue, the Medicare Advantage plan, we no longer accept. They're no longer working with Lee Health, and there's a couple other hospital entities within the area that are not taking their insurance, or that the contract has not been renewed. So adjusting accordingly to help the patients know the next steps. The insurance notifies them as well, but either changing to an insurance that the clinic works with, especially if we have established patients, or helping them with other options. So that is definitely something that we've been working through and navigating. And so far, overall, it's been going well. Now, when it comes to the copays, it can range from $20 to $75 per visit, depending on the plan. I definitely have seen where there's been no copay. They haven't had to pay anything. So, it can vary, but insurance is definitely helpful. Next slide, please. So the social worker role within the clinic, Justice definitely did a great job with covering this aspect. We are a resource, provide education and support, assess the needs of the patient and the family member, so that way we can connect to those resources in helping navigate and plan for the long term. Next slide, please. Another thing we also do is monitor the silver alerts. So the county coverage designation that each memory disorder clinic has assigned counties. So as silver alerts come in for those counties, we follow up with local law enforcement and then follow up with the family to provide resources. We also provide the now 3-hour Alzheimer's disease and related dementia training to the long-term care facilities and other community entities that are required to complete that every year, as well as those that are interested. So that's another aspect of our education component. Next slide, please. All right, next slide, please. In regards to community outreach, I volunteer with the Alzheimer's Association as well as a community educator. So we are able to partner with them and do education alongside with them, as well as different educations on brain health, the stages, dementia sensitivity. So I always joke, if anybody will listen to me talk, I will come and present. I love being able to educate. Knowledge is truly power. And we do music program monthly as well. So we're definitely excited about that. Next slide, please. So with the Dementia Care and Cure Initiative, as Dr. G mentioned, I co-chair our local one as well. And it is a group of organizations from the community that focus on our older population. And the goal is to get education out, especially in the underserved areas. So that way we're connecting to resources, making individuals aware of the differences between the dementias. And there are approximately 16 DCCI task forces within the state. So from North Florida to here in Southwest Florida. And we're fortunate because for our 5-county coverage area, Collier County also has their own DCCI. So there's a larger group of us to be able to help get the word out and educate. Next slide, please. So our clinic specifically was created in 1998. So we have been around for a while. And we cover Charlotte, Collier, Glades, Hendry, and Lee County. Our medical director is Dr. Christina Larezaletta Fajardo. And then we also have a nurse practitioner, Laverne Jones. And our local area agency on aging is the Area Agency on Aging for Southwest Florida. So they help connect to other resources as well as assist with the long-term Medicaid application. Next slide, please. This is our address. We have grown, so we now encompass 2 suites, but we are that continuum of care as well as other memory disorder clinics, from new patient appointments to diagnosis to follow-up appointments that can be from 1 month, 3 months, 6 months, or yearly. And we have the neuropsychologists, psychometrists on site as well as myself. So we are all there together to support the patients and the family members. Next slide, please. All right. Any questions? Thank you so much for having me.
Wow, that was just a comprehensive, meaty, helpful discussion. What a wonderful presentation, Stephanie. Thank you so much. Just a quickie question for you, and
Sure.
then we'll pick up at the end with the panel to ask more. What strategies have you deployed in assisting family members of loved ones with suspected dementia or cognitive decline to assist them with bringing the person with cognitive decline to the memory clinic when they're ambivalent about memory evaluation?
That is a great question, and something we definitely do see, often. Some of the tactics that I've discussed with family members, they've actually used it, is a lot of times if it's a spousal situation where the one spouse has no memory concerns, but the other spouse might, but they're very resistant, the spouse that does not have concerns will incorporate themselves into the evaluation process. So doing an appointment themselves, going through the screening, just at the end of the day, it's just to check, to see if anything's going on, and to make sure, everything's okay, or if there are concerns, what the next steps are. So making it like a team effort, if you will. If we have circumstances where, they are resilient to coming in, we do offer virtual appointments. So if maybe it helps for them to be in the comfort of their own home, and having the caregiver there as well, we have that option. I do memory screenings in the community as well. So that will kind of help get conversations going, especially if that is a concern. So I'm able to talk both to the individual that the memory concern is with versus the spouse that doesn't have any concerns. So we just incorporate it in a compassionate, loving way, making it so it's not something to be nervous about or hesitant with.
Gee, those are very thoughtful and helpful strategies. Thank you so much.
Thank you.
We have from Maricela Morado an affirmation. Great presentation, Stephanie.
Thank you.
I second the motion. We have an affirmation from dear Ann Floyd. What wonderful and great information from both presenters. Thank you. Thank you so much, Stephanie. And now we have Priscilla Jean-Louis.
Good evening.
What a great pleasure to have you aboard, Priscilla, and look forward to your presentation.
Thank you so very much. And I am grateful for this opportunity to be on here tonight with you all. Thanks so much again for that wonderful introduction as well. I'm on as a caregiver. As you heard in the introduction, I am a caregiver for my mother who lives with Alzheimer's dementia. I've been her caregiver for the past almost 9 years. Well, actually, it is 9 years now. As well as my grandmother, who also was with me for about 4.5 years. She passed away in 2022. And so that's where my passion for Alzheimer's dementia advocacy came from. And so as a part of that, I've actually been in connection with the Tallahassee Memory Disorder Clinic just through research and looking for different resources for myself, as well as those that I'm able to help in the community. And so just a little bit more of a history behind why it is so important to me. Alzheimer's dementia, it does run heavily in my family. And so right now, currently, I have my mom who is living with it, along with 4 of her brothers who also is living with it. And within the last 3 years, she's had 2 sisters. So I would dare to say that there is definitely a genetic factor there. And so when I first began caring for my mom, just realizing that, okay, there's something more that has to be done. That's where my research came and my passion and my heart. And so I am a diehard advocate for being able to provide the resources to others. And so with that, I found the Tallahassee Memory Disorder Clinic, and just a great resource that they are in our community. And what I try to do is to help people to understand the importance of early detection. There's so much that can be curbed if you get it detected early. And so I spend a lot of time, because there's a whole lot of information that I myself, family members, did not know. We just were not aware of the information. And so just in learning it, the Tallahassee Memory Disorder Clinic and the information and the resources, the way that they are in our community throughout our state, that's important. It's important, and to know that it is a free resource. The beginning stage, being able to get that memory screening free is very important. When you're a caregiver such as myself, and I believe one of them mentioned it, it is very expensive. It can be a very expensive task to care for your loved one. And so anytime you can get something that is beneficial, that there's no cost to, I think that everybody should take advantage of that opportunity, as many, especially if there is a component, like in my instance, when you have so many family members, and then both my mom's parents, so my grandmother that lived with me, I often tell people she was my grandmother by love, not by blood. We weren't blood, but ever since I was like 2, she was my grandmother. And so hers, she was old age. She was 98 when she passed away. I had the honor of serving her as her caregiver for 4.5 years prior to that. But both of my mom's biological parents, her mom and dad, they both had Alzheimer's, dementia. And so seeing it, not really understanding it at the time, and then so many other family members, when you have that component, I think it's very important that you take advantage of these type opportunities that are offered through the memory disorder clinic, to be able to go in to get that screening. When unfortunately for myself, with my mom, I did not have that information with her diagnosis. I actually did go see a neurologist. We saw the neurologist after having seen her primary doctor. We were able to, get referred to a neurologist and get that information. But for me, in my belief, I believe that, we could have been so much further ahead of that had I known at the time that the memory disorder clinic was there. And so, that's why I spend a lot of time sharing it. I have a website, and it's plastered all over my website, because I think their services are that important, being able, and they focus, as she said, not just on the person, but the caregiver. And that's very important, that social side of it, being able to help the caregivers to cope in the midst of it, because it's a daunting task. It's one that I do with joy, but it doesn't mean that it doesn't come with its challenges. And so having that support there, I know I can pick up my phone at any moment, call Justice, call Whitney, and they're there. And so it's an important component that, as a community, even throughout the state of Florida, if you're in that area, take advantage of it. I strongly suggest that you take advantage of that resource, because it's very beneficial, and it could save you a lot along the way. The information you get, when you start having those slight things that you think, could be, maybe not, if it runs in the family and there are some things that are going on consistently, don't be afraid. I think somebody said a little bit earlier, sometimes there's a shame that comes along with it for whatever reason, but it's nothing to be ashamed of. If you have that question, call the number, go get that memory screening done, because sooner is always better than later. It's so much better than waiting until, I don't want to say that it's too late, but that it's gone a little bit further than it had to be. And so, I mean, both of the presenters before me, I mean, that information, um, it's invaluable. That's what I've learned. That's why I spend so much time, because it is invaluable to have this right at your fingertips, and you don't have to wonder about it. I mean, there's a whole lot that I've learned through just my connection with them. And so, I mean, I cannot express it enough, but I tell all the time, thank you. I tell Justice, when I talk to her, when I talk to Whitney, thank you, because, the information that I've learned, I'm grateful. I'm grateful, and I'm going to always push people in that direction. And so, that's my thing for tonight, is just being able to encourage you. Again, I'm 9 years in. And at this stage in the game, it's a lot. It's a whole lot. And I'm still able to learn. I'm ever learning with it, ever researching, ever learning. And, I will pick up the phone and call and ask questions. And so, for the stage that my mom is in at this point, it's a whole lot further. But, being able to just utilize, Acts 2, Tallahassee Memory Disorder Clinic, I cannot express, and I just can't. I can't express how much it has meant to me, to have these resources at my fingertips. And so, take advantage. That's the best thing I can say tonight. Please take advantage of the resources and allow them to, be and do all they can do for you and for your family.
Thank you so much, Priscilla Jean-Louis. I have a question, unless Esperance, who's working in the background, wants to share a question or a comment from others. Well, there's an affirmation for you, Priscilla Jean-Louis. Thanks so much for sharing. I can totally relate as a caregiver. Thank you, Ann Floyd. Thank you, Priscilla. I have a question for you.
Yes.
You talked about, and I think this was quite poignant, about the importance of early detection. Could you elaborate just a little bit more about what are these specific benefits of early detection for the loved one with dementia and their family caregivers or caregivers?
I'm sorry. Okay. When it comes to that early detection, being able to recognize the signs and the symptoms of Alzheimer's, it's important, because there are things that, I mean, there's no cure for it. We know that there's no cure at this particular time, but there are some things that you can do that could perhaps slow it down. There are some different some different studies, some different trials rather, that you can become a part of, that there's no guarantee, but it may slow it down. There's some, when it comes down to different documentations and different things that need to be done ahead, but anything that you can do to help you still have a good quality of life with dementia. And that's what people don't recognize, that even though you may have a diagnosis, that does not mean that you can't still experience a good quality of life. But you got to be able to recognize and get as much help as you can get. And so there are various things that could possibly slow it down. It won't cure it, We're still praying for that cure, and you know, the research is there, but early detection helps you to be able to do the things that you can do to be able to slow it down perhaps, and still be able to live a good quality life.
Yeah, that's so important, Priscilla, because unfortunately, many folks, when they receive the diagnosis, believe it's a death sentence. But
Right.
actually, you know, and I know as a care partner for my wife with dementia, that there's more positive that emerges in the course of post diagnosis of dementia than negative. You have so
Exactly.
many opportunities to enjoy the moment, whether it's 3 years or 5 years, 10 years or 20 years, just to be in the moment and enjoy your relationship with the person who happens to have a dementia diagnosis.
Exactly. One of the things I often tell people is when you have this diagnosis and as you continue to live it out, there are some things that you're going to lose. But at the same time, ooh, did my computer just go out?
No,
Uh-oh, hello. I'm
we're
sorry.
fine. We're fine,
Um,
Priscilla.
okay, my computer popped.
Yeah,
You know, there
that's
are some
good.
things that you're going to lose in the process. But what I like to say as well as do is strengthen what remains, right?
Amen.
There's you'll lose a lot, but whatever's still left, strengthen that part, you know, because that's the part that still matters. My mom has no idea who I am. She thinks I'm her mother. But, you know, I have a t-shirt line that I do for caregivers as well. And my last shirt is love is greater than dementia. And I
Amen.
believe that with my whole heart. My mom does not recognize me as her daughter, but she does recognize the love that I have for her. And so no matter where she is when I appear in her presence, she recognizes love and she always gravitates to me. And so that becomes important. So
Yeah.
I just say strengthen what remains when you're there.
Thank you, because having that focus and intentionality to embrace that which is and that which is rewarding rather than reflecting on that which I wish is still would still exist is so important in deriving pleasure and reward from your relationship with your loved one with dementia. And thank you so much. We're going to move on now to Tamika Norton Brown, and just before we finish, we have another affirmation. Thank you, Priscilla, for sharing your story, and we'll continue in the panel discussion, Priscilla, accessing your wisdom and important tips for caregivers and loved ones with dementia. And now we have Tamika Norton Brown, Acts 2 Project Coordinator. Welcome, Tamika.
Thank you so much, Dr. G. And thank you, everyone. What I'm now going to do is to provide information on our Acts 2 project. Um, Acts 2, as many of you may know, we're a faith-based skills training and support program for African American caregivers of loved ones with Alzheimer's or dementia. Let me also preface up front that all of the services that we provide in Acts 2 are absolutely free. So there's no cost to partake in any of the services that I'll be telling you about. You will hear me talking about things like faith-based and prayer and scripture and faith sharing. So yes, we are a faith-based program, which means that we have woven those elements into the actual services, but we're also ecumenical. So we will provide assistance to any person, just like the slide says, how, where, and when they need it. So next slide, please. Okay. For our programs of services, we offer three major types of services. The first is our faith integrated group skills training and support for distressed African American caregivers of older adults with dementia across Florida, or our 12 session program is what you'll hear me refer to it as. And I'll give a bit more information on that in a moment. We also do dementia awareness presentations and workshops at faith community and elder care venues, as well as we have a very active social and print media that reaches across Florida and the US. And we also provide individual telephone-based problem solving and information and referral consultations. And that's available to all dementia caregivers and other stakeholders across Florida and the U.S. Next slide, please. Okay. For our 12-session program, let me also state that in order to participate in our 12-session program, it is for African American, Black Caribbean caregivers residing in the state of Florida and its relative caregivers, and we loosely define relative. And I always say that you can either be related by blood or related by love, and you need to be spending at least 6 hours a week in your caregiving duties. Does not mean that that person needs to live in the home with you. So you can be taking care of Miss Sally down the block who you've known your whole life. You love her like an auntie. If you consider that person to be your relative, then we consider that person to be your relative. And those stipulations only relate to the 12-session program. Our 12-session program includes 7 group skills building, so 3 caregivers in a group, and 5 individual sessions. All sessions are delivered weekly over toll-free telephone by trained lay pastoral care facilitators. Let me also state that when you hear us talk about lay pastoral care facilitators, those are basically lay persons from the community that have either been nominated by their adjudicatory leader or they've seen a presentation and said, hey, I think I'm interested in leading the groups, that we take and we train them to be able to deliver the 12-session program. In those individual sessions with the facilitators, they focus on goal setting and problem solving to address the concerns that have been identified by the caregivers. The majority of caregivers who come into our program have 2 or 3 things that they want to work on. Some of their goals are caregiving related, some of their goals are personal in nature, but they get 5 weeks one-on-one with that facilitator to address those concerns and come up with some strategies to help them achieve those goals. Next slide, please. Our program also consists of 6 major components. The first is an overview of the basic characteristics of the dementias. So every caregiver who comes into our program gets a Dementia 101. What is it? What are the stages? What are the signs? What are the symptoms? We also work with our caregivers on relaxation training that's combined with calming prayer and or meditation. We are actively breaking the myth that relaxation means I go home, I kick off my shoes, I sit in my favorite chair, and voila, I'm relaxed. But in actuality, there is an entire process of having mind, body, and spirit enter into the state of relaxation. So we teach our caregivers how to relax. We work with them on effective thinking about the challenges of caregiving coupled with scripture. Just being able to change the thought process, just to make little changes in their thinking as it relates to their caregiving situations. Next slide, please. We also have my favorite module, but I always say it's the one that I've yet to master. It's emotional well-being, or I call it the me time module. Being able to build in pleasant daily activities as a guard against emotional distress. So just negotiating, getting 15 minutes to be able to take a walk or to listen to your favorite type of music. Seems really easy when you say, oh, I'm just going to take 15 minutes, but in actual practice, it's very hard to do. So that's one of the skills that we work with our caregivers on. We also work with them on communicating effectively, not only with the care partner with dementia, but with their family and health professionals. And then lastly, on developing those effective problem-solving skills through that personal goal setting. Next slide, please. Now, when we talk about dementia awareness training, because I know that was one of the things that I mentioned that we will do. For dementia awareness training, that looks like the Acts 2 staff members, we will do both in-person and virtual dementia awareness training to family caregivers and other interested parties. And some of the example topics we cover, we do the basic information about the characteristic and stages of dementia. We talk about risk factors for Alzheimer's disease and related conditions. And we also cover strategies for preventing or delaying the onset of dementia. Next slide, please. for the individual problem-solving consultation. Now, this is available to any person, regardless of race, regardless of location. And those 1 or 2 problem-solving sessions are delivered over toll-free telephone by ACTS2 staff members. That caregiver will prioritize 1 or 2 goals, and we work with them on developing an action plan. And some of the more common problems that we help with are maybe they're having difficulties with bathing and hygiene for their loved one. They may be having challenges getting their loved one to eat, or difficulty getting help from family members. Next slide, please. For our information and referral consultation, same concept, available to any caregiver, regardless of race, regardless of location. That caregiver will prioritize their info and referral goals, and they work with the facilitator on developing an action plan. When I'm talking to the caregivers, I will typically ask them, give me your wish list. What are the things that you really need that would be helpful to you? And some of the more common info and referral concerns that I hear about are help in identifying affordable caregiving services. They want to find culturally responsive adult daycare centers, and then locating effective estate planning assistance. And what I would do is spend the time, either myself or a member of the staff will spend the time to find out what are the resources that are available in their area, and then refer them to those resources. Next slide, please. Here are just some dementia care resources that you may want to check out. And this information is also listed on our website, which you will take a look at in a few moments. There is the Florida Department of Elder Affairs, the Alzheimer's Association, the Alzheimer's Foundation of America, the Elder Helpline, Elder Care Locator, and the Alzheimer's Disease Education and Referral Center. Next slide, please. And how can caregivers contact the ACTS2 project? Multiple ways to get in touch with us. You can contact us through telephone, email, or through the web. We have a toll-free number, 1-866-778-2724, or you can call my local to Tallahassee cell phone number, 850-274-4945. And if you call that toll-free number, that will come to my cell number as well. We have my email address, tnnorton@fsu.edu. You can also contact us here on Facebook on our ACTS2 Caregiver Project. Send us a message and we will respond. We also have a website, www.acts2project.org. And what we're going to do now is bring the website and just take you on a little tour of that website. So if you'll bring, okay. If you would go to Program of Services. We have done a great job in trying to streamline our website so that if you come to the site, we've categorized the information so it would be easy for you all to pick out the different pieces that would be helpful to you. We have information on our 12-session program, our brief problem solving, all of the things that I've just kind of described to you a moment ago. You'd be able to find out, what to expect, what will you learn from info and referral, and those type of things. And so if you would go back up, if you would go to Caregiver Resources. Okay. On our Caregiver Resources page, we do have links to all of the live webinars that we have done here on Facebook. We include things like prayers and readings. There's information on the basics of dementia. There's information on caregiving, well-being. We have tried to pull together information that would be helpful and beneficial. So there's info on the 10 warning signs. There's information if you're having a problem with your loved one in sleeping. So there's information on managing sleep problems. These are some of the more common things that we hear about from the caregivers that we speak to. So we've included all of that information on our Caregiver Resources page. Okay. If you will go back up and click on Donate, please, ma'am. Okay. If you're interested in finding out how Acts 2 is supported, all of the services we provide are free, but we do have folks who have made investments into Acts 2. There are people who may want to give a gift in memory of a loved one. All of that information can be found on our donate page. And if you will go back up and click on Contact Us. Here on our contact page, on this page, you can do everything from asking a question or providing information if you want more information about the program, if you want to sign up for the program. I always encourage folks, if you think about something after this live and you want to send a message and you can't remember what the toll-free number is, that is also on this page. But if you fill out this form, it will also route directly to my email address. So feel free to come here. I always say, there's no such thing as a silly question. We want to help in any way that we can. So please visit our website, check it out. Let us know if there are any questions that you may have, and we will gladly help. What we are now going to do is bring everyone back up and have a panel discussion or any questions that you all may have. We'll have the full panel of participants available to answer those questions.
Hi there. We're having a little bit of static in the background. We may want, if you're not speaking, I'd suggest just muting at this point. That might help. I'm hoping that might help. Well, at any rate, we'll persist. Have a question for the panel, or the two social workers and Priscilla. What funding is available to caregivers and their loved ones with dementia to defray the cost of out-of-pocket expenses that may not be covered by insurance or those without insurance? I hope that's not a tough question.
No, I thought, Stephanie, do you want to start or how?
It doesn't matter to me.
Okay, I'll let you take a stab at it first then.
Okay. So there are definitely organizations in all the communities that provide caregiver resources and services at no cost. Like the social workers within the memory disorder clinics, as Justice mentioned, anything we do does not cost anything to the caregivers or the patients. The Alzheimer's Association services are free. And then particular agencies within the community, like I know here, Dubin Center in the Orlando area, it was the Alzheimer's and Dementia Resource Center. Their services were free. So there's that aspect. Now, if an individual is connected to the VA and I think their connectivity level has to be 80% or greater, they could be eligible for like aid and attendance, or the caregivers could get some assistance through that. So it would be no cost to the caregiver, the individual. If there's long-term insurance involved where the individual has been paying towards it over the years, that's something that can assist with like in-home services, adult day programs, and that higher level of care if determined it's needed. As well as, there's a long-term Medicaid aspect, but that can be a process, but that is a great benefit as well if the person qualifies and it covers towards the same things. And with the long-term Medicaid, the caregiver could potentially, family caregiver could potentially get a stipend for providing care. So there definitely are resources out there that can be cost-effective or free for the family that is caring for the individual. I know Florida has a legal helpline that does free consultations. And then if further services are needed, it's income based. So it may be more cost effective for them than an elder law attorney because those prices can vary.
Thank you, Stephanie. Justice?
Yes, and just like piggybacking off what Stephanie said, exploring your local community resources is going to be a big help, because a lot of times they have received grant funding from from the state organizations or just donations that allows them to provide free services to the patients and their families. I know with the Alzheimer's Project, they offer respite care, and that service is free. And they have different locations every day of the week. So if the caregiver needs a break, maybe for a few hours just to run errands or just to breathe or take a nap, looking into that resource is going to be very helpful.
Thank you. And now we have a comment from Ms. Katisha Bryant. Yes, what support can we get to assist with respite care? Do you want to weigh in on that, Malally and Tamika?
Sure. So with the respite care, there's definitely a lot of private duty companies in the communities that can assist with that, from a few hours a day, a week, to 24/7. Depending on the need. That's where those benefits can also be part of the mix, from the VA to long-term insurance to long-term Medicaid, because they assess the need with those as well. I know within Fort Myers or Lee County area, there are a couple organizations that are volunteer-based, so their goal is to help the older individuals stay within their home. So they come and provide companionship. And some of the facilities as well will provide that respite care option where families go on vacation or have an emergency arise. Their loved one can go to a local memory care or assisted living and stay there, receive that 24/7 care while they're gone, and then, are coming back home once the family member returns.
Thank you so much. Here's another question for you, a little bit different tack. We did mention, and you in particular mentioned, Stephanie, the Dementia Care and Cure Initiative Task Forces. We have two co-chairs with us. Could you, and I know that Tamika and possibly Priscilla are involved with the Dementia Care and Cure Initiatives here in Leon County. Would you tell us a little bit more about projects that your areas may be doing, or other projects across the state that are supported by volunteer task forces, the DCCI for short, Dementia Care and Cure Initiative Task Forces?
Justice, do you want to go first, or you want me to?
I think I put you on the spot last time, so I'll take it. So right now, one of the things that we're doing, we have an educational series for Gadsden County, and that's where we have different members of the task force going out and doing presentations for that senior center in Gadsden County and just spreading awareness. So each month, we're meeting them on, I want to say it's the second Tuesday, hour-long presentation discussing various topics. But in the past, we also provided training to Leon County Sheriff's Department to ensure when they're responding to calls, one, they know how to respond and they can understand the symptoms that they may encounter. But it's just a lot of educational training that our current task force is doing here locally. I don't know if that looks different for you guys, Stephanie, on your end. But we are definitely developing more programs that we can put in the community for individuals with dementia. But as of right now, we're focusing more on training.
Same for us. Definitely a lot of education with different businesses. We've connected with the fire department, law enforcement. We're quarterly in the library system down here. And then whoever is interested, we've gone to communities to provide the education, 55 and older communities. And I know our focus is going to be directed towards businesses as well, because the task force and Department of Elder Affairs has partnered with Department of Health and focusing on the state health improvement plan. So we're going to have some additional education for the business sector to be able to provide training. So that way, restaurants and businesses are more aware of dementia, to coincide with dementia-friendly dining that we have in certain areas of the state and things of that nature.
Thank you so much. Just shifting once again to a different topic. Priscilla, would you like to speak to your efforts with Favorite Girl Caregivers Corner podcast and other outreach activities that you provide as a care partner of a loved one with dementia?
Certainly. And so the My Favorite Girl Caregivers Corner podcast, that is a podcast that I started to help strengthen and empower caregivers. My motto is keep going, keep loving, keep loving, and keep caring. And so reason being is because a lot of times, caregivers just, sometimes you can get in that space where you feel like it's just you're all by yourself. And so I started the podcast because I wanted to help strengthen caregivers, to help them to understand that, yes, absolutely, it's difficult, but you can do it. And so just building a community of support around caregivers so that they understand that they're not alone in this, and you can do it. And so that's what the podcast is all about. And so I bring on, I did a series with just resources, those who provide the resources in our area, because what I've come to understand is that a lot of people don't know that a lot of these resources are even available in our community. And so I brought on a lot of different, I had Tamika on with Acts 2 and some other various ones, just so people can understand what's out there and what's available. So that's what the podcast is about, as well as just different caregivers that come on to just simply share their journey. I'm a big proponent of sharing your story. I think storytelling is the greatest way. It's your testimony. It's you being able to show people live and in person what it's all about. So that's what the caregiver is. The podcast is all about. You can find it on iHeartRadio, on Spotify, YouTube. And then my website is just www.priscillajeanlouis.com. And so what we've also done, my daughter and I, she's actually my care partner as well with my mom. And so we recently in June, we did a one-day Alzheimer's awareness and education conference. And so what we did, because I have so many people that reach out to me from churches, faith-based community, those in the community as well. But I had so many from church that were asking. And so what we decided to do is to bring those of you with the information, bring everybody together and bring in those who were looking for the information, faith-based community. We brought everybody in one space so that everybody could get the information. And so that is something that is going to be an annual event. And it's just to be able to bring everybody together so that we know what the resources are in our community and we can take advantage of those, because they are much needed. And, I'm going to always say, take advantage of the help and the assistance that you can get. Learn as much as you can, research it, and then reach out and get the help, because it all helps. So that's what My Favorite Girl Caregivers Corner podcast is all about. And as well as, and I work very closely as well with the Alzheimer's Association. And so I'm usually up on the Hill during session, up there testifying and just helping to push some of the bills. And so get involved even in that aspect, because we need these bills to go forth as well, so that, those who are living with the disease as well as those who are caring can have as much assistance legislatively as we can. And so also get involved with that. Tallahassee Walk to End Alzheimer's, that's coming up. That's another great opportunity And so take advantage of all of that.
Thank you so much, Priscilla. Now
Yeah.
it's that very helpful information, very impressive. Impressive. I have a feeling you're a Renaissance person. After having gotten your bachelor's in criminology, you became a marketing genius, a marketing professional genius. At any rate, I'd like to get a final parting comment from each of you, and we'll start with Justice Lewis.
I should have known, Dr. G, you're going to put me on the spot
Of
first.
course.
But yes, if you don't remember anything that we discussed today from the presentation, is let's end the stigma when it comes to discussing this, and don't be afraid to receive the help that's out there. There's so many resources in our community. Like I said, not only for our patients, but for our caregivers as well. Like Ms. Priscilla said, take advantage of the free services. We're here for a reason. Do not hesitate to reach out to your local memory disorder clinic.
Stephanie Malally.
My words are definitely, we are here to help. Please reach out, and you are not alone in this journey. We are definitely here to be a part of the journey with you. So we're here. So give us a call.
Thank you. Priscilla Jean-Louis.
Absolutely. And my advice and my encouragement to everybody is, again, take advantage of the resources that are out there. If you are a caregiver, please know and understand that you are not in this alone. We are on the same journey. We may be on a different road, but it's the same journey. And so, my thing is keep going, keep pushing, keep loving, and by all means, keep caring.
Amen. Push ahead, people, by the grace of God. And now, Tamika Norton-Brown, final comment.
I would just ditto what everyone else has said. And I know that sometimes we throw a lot of information out to you all in a very, very short amount of time. This broadcast will be posted up on the Facebook page. Feel free to go back and look at it. We do have copies of all of the presentations, the PowerPoints that were done this evening. So if you've not received a copy, reach out to me. I will gladly provide that information to you. And if you don't know where to start, if we've thrown so much at you that you're sitting there going, okay, I don't even know where to start, call our toll-free number, call my local cell phone number. I work very closely with all of the folks here this evening, and I will absolutely connect you with them. We are all in this together. We all want to see everybody win at the end of the day, and we will all do whatever we can do just to make sure that even if the journey is a long and hard one, that if we can make it a little bit easier, that we're willing and able to do that.
Thank you, Tamika. Oh, there we go. Katisha Bryant, I love the idea of strengthening what remains. Amen. Thank you, Katisha Bryant. Appreciate that thought. We have Dr. Zen Novakovsky. Love your presentations, Priscilla and Stephanie. Great information. And Justice, just great information relayed with heart and love. I'll just put that in there. Ann Floyd, thank you, Ann Floyd, for your active participation tonight. Information and support I received was and still is invaluable. Thank you, Ann Floyd. And wonderful presentation, Tamika Norton-Brown. Thank you so much for sharing your experiences. And thank you, Dr. Novakovsky, for your input. And McGargy, thank you, Priscilla. I'll look forward to your next your podcast. And my parting comment is this: please follow us on Acts 2 Caregiver Project's Facebook website. Our next workshop, folks, will focus on music and its role in family caregiving of loved ones with dementia. We'll have a music therapist from Florida State University participating, and others. So please join us. We will announce the date for this workshop in the Acts 2 Caregiver Project website. Thank you so much and have a very rewarding. Thank you, Corey. Thank you very much. Very great presentation, everyone. Thank you for joining us, Corey Howard. Thank you for all the information from Kantisha Bryant, and thank you, Miss Bryant. Any others? Don't want to eliminate any affirmations for this group. Thank you and have a very blessed evening.